BSI, scene is safe.
Scene is safe.
Okay. What am I called out for today?
You were dispatched to report of a male that fell off a 15-foot ladder.
Okay. Is this my only patient?
He is your only patient.
Okay, it's my only patient. The mechanism of injury was a fall from a ladder. I'm going to go ahead at this point request additional assistance, ALS backup.
ALS has been dispatched.
Okay. And because this is a fall from a ladder, I'm going to have my EMS partner go ahead, take and maintain neutral inline stabilization of the head.
Your partner has taken over that task.
Okay. My general impression of this patient is a 50-year-old male, fell from a ladder, lying supine. Are they alert to verbal? Sir, can you hear me?
No response.
Okay. Try pain stimuli. Are they alert to pain?
The patient does groan upon pain stimulus.
Okay. So they're alert to pain. Chief complaint at this point in time is the fall from the ladder and the altered mental status. Okay, at this time I'm going to go ahead and check the airway. We're going to do a modified jaw thrust. Open up the airway. Do I see any?
No obstructions in the airway.
Okay. And then breathing, I have a breath rate of?
With the airway open, your patient is breathing 18 and shallow.
18 and shallow. Okay, at this time we're going to put the patient on a non-rebreather mask at 15 LPM. Do they accept that?
They do.
Okay. Circulation, do I have any major bleeds for my patient?
No sign of major bleeding.
Okay. I'm going to check a pulse. I have a pulse rate of?
Pulse is present, 110 and thready.
Okay. And I'm going to go ahead and check skin color.
Color appears to be a little bit ashen.
Okay. Temperature?
Temperature is cool.
Okay. Condition, is it sweaty, dry?
A little bit moist.
A little bit moist. Okay, we're going to go ahead at this point and treat this patient for shock. We're going to cover him with a blanket. We're going to tell the inbound ambulance to warm the cab up to 90. And we already got him on oxygen, so they've got the appropriate oxygen therapy. And then the transport decision for this patient is going to be rapid because of the mechanism of injury and because they're exhibiting signs of shock. Okay, at this point, is there any bystanders we can ask for a sample history?
There are bystanders, but nobody knows his medical history.
Okay. If the patient was responsive verbally or if there were bystanders who knew his medical history, I would ask them about allergies. I would ask them about medications the patient's on. I'd ask them about any pertinent medical history. I would ask them about last oral intake. And I would also ask them about events leading up to this, where the patient is now, which probably is a fall from the ladder. At this time, I'm going to do my head-to-toe assessment. I'm going to move to the patient's head. I'm going to check full body for decap BTLS. Decap BTLS is going to be checking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. Starting at the top of the head, I'm palpating. Do I feel anything?
Scalp is intact.
Okay. I'm going to look at the ears. Any fluids coming out of the ears?
No sign of fluids.
Okay. We can check the pupils. Are they equal, reactive, not equal?
Right side is reactive, left side is blown.
Okay, we're going to note that. Any other apparent facial trauma?
No sign of facial trauma.
Okay, I'm going to palpate the back of the neck. Do I notice anything?
Nothing noted.
Nothing noted. Okay, at this point we're going to go ahead and put a collar on this patient. I'm going to check for jugular vein distension.
No JVD.
No JVD. We're going to check for tracheal shift.
No sign of tracheal deviation.
Okay, we're going to take the patient's shirt off, expose the chest. I'm going to start palpating, starting with the shoulders, the clavicles. Any crepitus?
No sign of crepitus.
Okay, again checking for BTLS, come down the chest. Do I feel anything in the ribs?
Everything feels stable.
Okay, we're going to go ahead at this point and auscultate the chest, listening for breath sounds.
Lung sounds are equal and bilateral.
Okay. Okay, we'll come down to the abdomen. We're going to palpate 4 quadrants of the abdomen. Anything to note? Any distension?
You note distension and rigidity in the upper right quadrant.
Okay, distension and rigidity, upper right quadrant. We'll note that for now. Come down the patient's pelvis. I'm going to push in. Any crepitus?
No crepitus, but it does seem to shift when you press in.
Okay, we're gonna note that. We're gonna push down.
Down is solid.
Okay. We're gonna come down, pull the patient's pants off. Any priapism?
No sign of priapism.
Okay. We're gonna come down, palpate the legs, front and back.
Minor abrasions, right leg.
Okay. We'll treat those later. Come down to the feet. Checking for a pulse.
Pulse is present.
Okay. Patient's unresponsive verbally, so they're probably not going to push back. So it won't be able to check their motor function. We'll give a pinch and see if they have any reaction to that at all.
Again, lets out a little groan.
Okay. Come down, we'll do the other leg. Again, checking for decap ETLS.
You notice a deformity halfway between his knee and ankle.
Okay. We're going to come back to that and splint that. And now checking CMS. Pulse.
Pulse is present.
Okay. Any reaction to a pinch at all?
Again, he groans.
Okay. Come up, check the upper extremities now. Anything noted?
Minor abrasions, upper right arm.
Okay, we'll come back to those and bandage those. And again, checking for pulse.
Pulse is present.
Okay. Any reaction to a pinch at all?
His face grimaces slightly.
Okay. Other arm, I'm going to palpate both sides of the arm all the way down. Noting anything at all?
Nothing noted.
Okay. Okay, at this point, we're going to prep the patient for putting him on the longboard. So we're going to go ahead and log roll the patient. We're going to palpate the patient's back. Anything of note on the patient's back?
Nothing noted.
Nothing noted. Okay, we're going to put the patient on the backboard. We're going to go ahead at this point and take a baseline set of vitals. Can I go ahead and get a blood pressure, please?
Blood pressure is 100/50.
100/50. Pulse?
Pulse is 110 and thready.
110 and thready. And the breath rate?
Rate is 18, still a little bit shallow but adequate.
Okay, volume's a little bit shallow but adequate. We have the patient on a non-rebreather still at 15 LPM. At this point, we're going to go ahead and get the patient loaded onto the ambulance. We're going to reassess vitals every 5 minutes. We're going to ask about blood pressure again, breathing rate and quality. We're going to check pulse. We're going to check the skin color, temperature, condition every 5 minutes. And we're going to treat the secondary injuries. We had a leg to splint down here. We have minor abrasions on the extremities. We're going to go ahead and bandage those up. We're going to reassess this patient every 5 minutes and get him to the ambulance or get him to the hospital.